Well, Elliot, we're back again. This is like the holiday edition or the last show of the year. How you
I
feeling?
know. I feel good. I have a Santa Claus hat and I was gonna put that on, but then I know if I do that, my hair's gonna get all messy and I'm too vain for that. Wait, I have a Christmas tree over here. I can show that
Okay.
a bit
Yeah,
later, but
let's see the tree. You
oh,
gonna
okay.
yeah, we gotta
Uh,
see it.
my Christmas tree. So I'll put that right here. It's a kind of
Looks
like a
like
Charlie Brown. It's like a Charlie Brown tree,
Yes,
but
it is.
yeah.
It
you know,
is. It
I could
is.
do something like this, and then it's definitely a Charlie Brown tree.
Nice.
What do you think?
There you go.
Nice.
Yeah, it's
Yeah,
not real.
yeah, we can tell. I'm not sure it's been fluffed appropriately.
Awesome. Yes, but happy to be back. I mean, this is great. We have a really, we're continuing a discussion, I think, around artificial intelligence and
Yep.
in healthcare. As I remember, we started a really good conversation with Matt Jackson, David Lipensky, who's one of our guests returning. I think has been part of those early discussions, and along the way, I think we said, okay, this thing is really worth continuing, right? So I think this is sort of a, ongoing. This is the sequel in all of that, right? So we have David Lipensky with us as well. As in addition to David, we also are joined by Kiran Chahal with the Insight digital innovation team and our artificial intelligence in healthcare practice. So Kiran, I know you can spend a lot more time getting detail in terms of where you are right now with Insight, but I guess along the lines of, we sort of prepped you a bit. We told you that our tradition is to kind of ask our guests to give us a narrative in terms of their career and where they came from and how they got to where they are. We've always found that to be really interesting. So I'm wondering, we've heard David's before, and maybe David, after Karan's done, you can give us a real Cliff Note version. But Karan, would you mind telling us a bit about your past and how you get to where you are today?
Yeah, I mean, I have a very interesting, very diverse kind of background. I started with my professional career with being a molecular geneticist. So my first degree, master's and bachelor's, was in human genetics, molecular genetics. And I was actually one of the very few who was selected by Michigan University to pursue PhDs, fully funded, PhD scholarships on population genetics.
Yeah, every time I hear these backgrounds, Bob, I just feel horrible about myself.
Yeah, I actually think we should stop the podcast
No,
because her intelligence level has tripled your and I's combined. And
No, Bob Elliott, there is interesting stuff to come. I came from a community like Indian background, the family background where it is kind of, oh, girls should get married by 25. Girls should get married by 25. And 20 years ago, I think 98, I got married. Yeah, it was, you should get married. So everybody in my family was like, oh, you got to get married and you got to do PhD, whatever you want to do afterwards. That's it. So yeah, I met my husband in New York. He's from a UK, went to UK, and over there wanted to do master's and PhD. Actually, some kind of a further extension of my molecular genetics background, because my husband is a core IT person. So I thought bioinformatics would be good. But that is how I got into information systems and computing, because I was seeing Human Genome Project at that time was in its full glory, Sanger Institutes, and they all were working on it. Bioinformatics would be great, but that's how I got into information systems and computer science. Worked in industry, especially business process re-engineering and all those kind of transformations at that time, automation of business processes. And when I was working, realized there were certain problems, certain decision-making angles, complex. We don't have the right tools to solve right kind of problems. The approach is normally we have a tool, and instead of problem dictating what tool we should use, we actually tailor the problem to the tool we have in the hand, right? And that was kind of so that's what actually led me. There is a gap. There isn't anything right I can find out. So that's what actually led me to pursue my PhD doctorate in kind of decision sciences and quantitative modeling, which is more of a mathematics for making effective decision making. And that actually coincides so well with the healthcare appetite at that time, because healthcare was moving from gut feeling decision making to more like evidence-based decision making. So I was a doctorate. I worked in university as an academic. I was the module leader for MBA executive program for quite a few years, then went back to university, back to kind of full industry full time. 5 years ago, um, my kids are all settled. They don't need me. And I was like, I need to be in the place where the action is. So I moved from London to SFO, and the journey's been incredible. Yeah, so I was at Hitachi Vantara before joining Insight. I've been at Insight since last 6 months, and digital transformation in healthcare, leading that for an organization like Insight with incredible culture, couldn't have asked for a better. This is the best place to be in terms of healthcare digital transformation. It's happening. And Insight, brilliant culture, brilliant technical acumen. That's where I am.
Yeah, perfect. Thank you very much. David, do you want to jump in with a couple minutes?
Yeah, just to make everyone feel worse, I started off in commercial banking, and then 2 years after that, I went to work for Columbia Pictures, and I worked there for 5 years in Hollywood. And then I went to work for Microsoft, and then from there left to start my own healthcare company that was focused internationally in the Canadian healthcare market. We got funding and built that up, and I had an exit in 2012. And I was also brought back to Microsoft to basically run their health services group for Canada. That was way back in 2008 when the first journey into cloud and Microsoft and healthcare began. With a connected health story. And then from there, I came to Blue Metal and was acquired almost 8 years ago now. I think January 2nd is my 8th year anniversary at Insight. And then we've been at Insight ever since. So just as I've said, there's never been a better time in the history of healthcare to be in healthcare due to the technology and the enablement, the capabilities that are accelerating discoveries, the global collaboration, simply even around COVID has been, astonishing. I think everyone's gotten a sense for, wow, things are moving a lot more quickly in life sciences and discovery than they ever have. And so the opportunity to continue to permeate that through, different levels of the industry and different sectors of the industry is really what gets me up in the morning and makes me super excited. So looking back, I've got almost 25 years, I think, in healthcare and life sciences experience. So long run.
Yeah, I bet you've seen a ton of change.
Yes, a ton of change for the better.
Yep. Yeah, right. Well said. Well said. So earlier when we were just before we got on the call, I think David, Kiran, you were both mentioning that we're seemingly in front of a tidal wave of development, a tidal wave of evolution, and that my guess is that there's a handful of variables that are driving, these outcomes. And then I'm sure you could articulate what that means when you say there's this tidal wave of innovation right now. Could that be a place for us to start the conversation?
Sure.
Sure.
Any thoughts? Come on. I'd love to hear what you think.
I think we are just at the right time when the convergence of technology is happening and there is a right appetite. Sometimes you can have those technical feasibility and all that, but then the appetite from the user side, from the community where it's going to have impact is not there. But we are at that phase where there is full appetite and we have the maturity of technology, maturity of very diverse technologies, be it genomics, be it IT, be it computing, the infrastructure side, the data side, and all this convergence point is such a kind of a unique opportunity to benefit the society, to benefit the humanity in a very, very positive way.
Okay.
Democratize healthcare.
Can we talk about the healthcare, and specifically hospitals as a business? I have a question. I at Insight, I work with a few hospitals, and it's very interesting to me that they're on different spectrums coming out of COVID or during COVID.
Yep.
One hospital I work with said that they lost a lot of money during COVID because they weren't able to do other surgeries and things that really make the hospital money. other hospitals I read about in the news and the media is that they've had some of the largest revenues that they've ever had due to COVID. Can you talk a little bit about what's going on in the industry as a whole, and where are they seeing successes and where they're struggling on a high level?
Sure. Great question. So I think we have about 6,000 hospitals across the United States, and about almost 1,000 of them pre-COVID were basically in plus or minus single-digit P&L margins. So you're talking about mid-level rural hospitals, community-based hospitals that are vital and essential to healthcare across the country that were really struggling. COVID, in terms of the government reimbursement around folks with Medicare and Medicaid or uninsured, that's been largely supported by government funding. But when you're talking about upper level hospitals, when you think about Mass General Brigham, you think about Cleveland Clinic, those types of higher end surgical preeminent institutions, their bread and butter is surgery and throughput, right? So I'll give you an example. At MGB, Mass General Brigham, Partners Healthcare, it's the largest health system in New England, affiliated with Harvard Medical School. So pre-COVID, if you were going in for a shoulder surgery, like an orthoscopic surgery, by the time you were completed to the time that they scrubbed the OR down and basically rolled a new patient in and prepped the whole surgical suite was about 11 minutes. During COVID, it's over an hour. So they've got to come in, they've got to fog the room, they've got to wait for the fog to settle, then they've got to mop the floors. And so when you're talking about the ability for specialty, connective tissue, GI surgeries, and obviously orthopedic surgeries, those are the bread and butter of those institutions, those hospitals. So when you're reducing throughput that significantly, it has a major negative impact in terms of their P&L.
Interesting. Gotcha. So if they're going from 11 minutes to an hour, their throughput is basically decreasing by a huge amount of surgeries every day, every week, every month then. So they're
Sure.
losing that revenue. Interesting.
Yep.
Okay.
There's only so many ORs to be able to do the surgery. And then you've got people, especially in and around elective surgeries, that certainly waited for 3 to 6 months or longer. And obviously there's a horrible opportunity cost with respect to waiting to see the doctor, especially when you get into more urgent things, such as when your knee hurts or you fell. There are things you can do to mitigate that. You can put a brace on, you can ice it, you can elevate it, you can do different things. But when cancer's metastasizing and you don't know it, or my mom had a brain tumor removed just before COVID, and she hasn't been to her last 2 scan appointments because there've been spikes in COVID, and she's immunocompromised. So that's a perfect example of when the system's disrupted to this degree, and we have to treat patients with COVID, and certainly we do. It does put a tax on healthcare in a number of different ways in the system, both financially and from an outcomes perspective.
And I guess, is there an AI approach that improves throughput, or is that just sort of the state of affairs right now?
I think, yes,
Yeah.
David, please go ahead.
I was just going to say, telehealth is certainly exploding.
Yeah.
So virtual consultation is going to be a continued growth phase for healthcare, and we're getting to the point where the government and payers, insurance providers are willing to reimburse for those visits that, post-surgical appointments, for example, depending if it's minor surgery. Let's say you got a wart removed, or you had a mole removed from a dermatology perspective. Well, you can get on the phone and have a virtual appointment and put your camera right on the area, and you can send images into the doctor that can be blown up that are high res from your phone. So there are things that can be done from a telehealth perspective that allow that visit and that continuity of care to continue without being disrupted, but leverage virtual consultations either pre or post surgical.
And AI chatbots, especially in the COVID, actually identifying triaging depending upon the symptoms, that was a great success during COVID. But again, it comes down to digital transformation. The organization, especially the healthcare hospitals, which had a better kind of robust operational backbones, had lesser of a technical debt. They were agile enough to incorporate and leverage these technologies. We've seen hospitals like Cleveland Clinic, they're like pre-COVID and post-COVID, there is a kind of a phenomenal jump in telemedicine. Mm-hmm. So definitely, if your operational backbone, your kind of you don't have technical debt, you're on cloud, you're on the emerging techs, it's much more easier to leverage and new technologies to pivot your business models, how you interact with your patients, how you engage with, how services, remote monitoring is happening with computer vision and so on. And it's just if you have robust data and AI kind of a strategy, how to leverage data and how to leverage data from all these wearable devices to actually serve the population better.
I think one last thing I'll say is certainly rely on computer vision, and to Kiran's point, the opportunity for resources that are more scarce, such as reading scans, radiological scans, especially when you get into the rural hospitals. They're able to take the scans, but do they have the radiology capacity to be able to get those reviewed in a timely manner? Does that patient need to stay in the hospital? Do they need surgery immediately? Do they need to be transferred to a larger institution? So, or can they wait? So a lot of those scan readings are very timely. So being able to do that virtually and go to centers when there are surges where there's more capacity, radiological review capacity, and then being able to get those answers back quickly to those rural hospitals is something that I think is really important. And we're actually working on a project right now that's government funded to basically allow certified clinicians to remotely set up and manage infusion pumps and ventilators. Setting up an infusion pump is and managing it is much simpler than the complexity of setting up a ventilator. But again, if we can start to create the backbone to enable that capacity, so we can take care of patients in real time, but be able to do it remotely with expertise and care and AI, then that's providing the scale that our health system is going to need more desperately than ever, because we're going to continue to see attrition in the healthcare ranks from the top down. Our clinicians globally are just overtaxed, and they're tired, and they're getting burned out, and there weren't enough of them anyway. Our curve is negative. If you look to the future, we're an aging population. You use 80% of the healthcare in the last 20% of your life, and we're seeing a precipitous decline in the number of clinicians that are still serving patients, and there's been a reduction in both medical and nursing school continuation and graduation. So we are going to need to leverage technology to help bring care to people and to best manage care for people that need it in different ways.
Just to add on to David's point, leveraging data and technology to the number of medical graduates declining. I have I always say half of my family lives in Silicon Valley, the IT kind of, I'm a typical Indian, right? Half into IT and half into the medical profession. And and I see the burnt out. Why graduates at kind of medical graduate numbers are declining continuously. And it's just kind of all the administrative work they have to do, the records the data they have to enter into computer, and the lesser and lesser time they spend with patients. And also the time they spend with patients, the engagement, it's not like one-to-one, which they enjoyed and which was actually the kind of the criteria why they started, why they wanted to be. There are certain empathetic kind of traits why you want to be a doctor, medical doctor, right? And they were being compromised on those. And data and AI have definite kind of a large play to help a physician in that domain where they can really start enjoying it. There's a company called Nuance. They have developed Ambient Dragon, which is like the doctors, they don't need to enter their notes while they're seeing patients. The technology automatically transcribe the notes and enter them, kind of integrate those into EHR. So those things kind of they can definitely help and also increase the throughput, because doctors spend a lot of pajama times actually writing the notes, putting the notes into the systems.
Yeah, no, really super. And all of that does tie to AI. You know, when we talk about the being able to listen to somebody transcribe and it capturing it and putting it into data, that's, you know, I mean, that's part of it. The one of the things that, you know, David, you brought up, which I find very fascinating, is the idea of using AI for diagnosis. I think, you know, you're saying, you know, and that makes a ton of sense to me. And I know that it's not a perfect answer to diagnosis. I know it's a combination of physicians plus AI, but it does give that scaling benefit that I think you're talking about, the ability for us to be less body dependent, you know. And I guess I wonder, how do we collect that data? You know, is there a central repository for, you know, if there's CAT scan data that has specific diagnosis, and, you know, who's capturing that data? Where's it being, you know, held, and how does that work?
So when it comes to imaging, imaging is one of the best examples of where AI can make meaningful and massive difference. Computers can see at the megapixel level. We as humans cannot. So when you're talking about slight anomalies in scans that are almost nearly undiscernible to the human eye, we have an opportunity to leverage computer vision and what I like to call is informed clinical decision support, right? We're not going to basically give a patient a diagnosis and spit out, you know, the answer and hand it to a doctor. What we're going to do is to say, this is why we're concerned, or this is what we think it is, or this is where you should look, and this is what we're concerned about. So we want to lead them to their discovery when we see things that are concerning to us. So, you know, those scans are taken and they're stored in repositories called, you know, PACS systems, and then those are obviously available through the EMRs, through the hospital systems. So from an academic research perspective, we can actually, you know, do a machine learning algorithm on different patient cohorts with, let's say, astrocytoma brain tumors at different stages, and look for commonalities or similarities from an academic and clinical research perspective, or any tumor anywhere in the body similarly. But I think the biggest goal near term, which is going to save doctors time and give them more time with patients. And there's a huge, vast treasure trove of information, both from a research and a precision medicine, personalized medicine perspective today, which is in the clinical notes. If you know, using Dragon software, and which Microsoft just acquired this year, and they're bringing more pervasively onto their healthcare platform, but being able to speak as a clinician and develop the clinical notes rather than have to type them into a system tabularly or write them down in check boxes, and then have that system be smart enough to basically input that information consistently and predictably every time in the EMR, which is a huge benefit. And then to be able to mine that information and understand those clinical terms, and to be able to do something meaningful with it, to search that and understand, maybe there are correlations here that need to be pushed up and elevated, you know, to the specialist, that to help them understand, you know, almost like kind of looking at a word cloud, right? So being able to have starting points where we can help to light the way for clinicians to be able to focus their time and energy much more quickly and specifically. And clinical notes is going to be a massive benefit to not only inpatient care and precision medicine, but also to academic research going forward. It's the biggest untapped area of power in healthcare we have.
And coming down to especially imaging and image recognition, I mean, it's kind of getting more and more proven that the AI computer vision is performing even better than the humans, and it's also kind of
they can just see what we can't.
And the way I understand precision medicine, in a, you know, again, just at a very high altitude, it's, you know, when we seek to diagnose what's concerning a patient, the more data we have from distributed data sources, the more accurate we can be in creating precise diagnosis. And that artificial intelligence and all the massive amounts of data that's out there give us the ability to be more precise in our diagnosis. And then prior to AI, the diagnosis would be limited to what a particular doctor knows and is limited to just sort of a general understanding or less data, right? Is that the nature when we talk about, you know, precision medicine? Is that what that is?
So precision medicine is, oh, go ahead, Kiran.
Please, David, I will just add on to your point. Okay. Yeah, please go ahead.
Okay. So yes, that's precision medicine in part. But when you think about understanding a patient at the genomic level, right? Basically understanding them as a human being apart from any other human being. What are their genetic predispositions to disease? What are their genetic predispositions to obesity? What are their genetic predispositions to heart disease? There are things that could be genetically modified in the future. You know, there's ethics, you know, questions that, you know, we won't open that can of worms today. But if you know that you can make a gene modification that is going to reduce or eliminate a chronic disease in the future that is going to impair the person and add cost to them, the healthcare system, and you can eliminate that and make them a healthier human being at any point in their life, then that's an opportunity to do, you know, the right thing, provided it's done the right way ethically. So, you know, genetics is going to become it's not only going to be just your problem list, your what are your medications, you know, how do you smoke, do you drink, do you exercise? It's going to get down to the molecular level in terms of having a much deeper understanding of your physiology personally and your family's physiology similarly, and understanding, being able to force multiply on your health history story and be able to leverage that information, and then to design therapies that are specifically targeted for your immune system, right, at the molecular level. So this is something that's becoming much more pervasive and commonplace with cancer treatments that are usually less invasive and are having a higher degree of success and outcomes. So we're definitely moving in the right direction, and that's something that, you know, 5 or 6 years ago, you had to go to Sloan Kettering or Mayo or MD Anderson to kind of, you know, sink your teeth into. Now you're able to do that in, you know, any city, any major city across the country, and be able to get to that type of care. So that's exciting. And then being able to again have more data that's organized to be able to research disease and cohorts of disease, and do that at a global level and in terms of collaboration is really exciting.
Yeah.
So yeah, go ahead, Kiran.
So just add on to David's point. So genetics one, and there's so many variables which actually affect the health outcome of a patient and which actually affect the what treatment they should be given. Genetics one really big variable. Then social determinants of health. Then the longitudinal kind of their health records, like which David just mentioned a couple of minutes ago, the ability to mine data from the EHRs, right? So it's just not possible for a human to comprehend all those different variables, right? And different problems. But the computers, data and AI, I mean, they definitely augment. They have that ability to comprehend the data from multiple sources and data which have multiple kind of impact. So definitely, I mean, this is kind of the direction in which we can have a more tailored, more precision, more personalized kind of a treatment for a patient, which will result in better outcomes.
So that leads into where I was going with my question. So that's perfect timing. So I'll give you a recent situation I had with my family member. We went into the hospital to do a procedure. It's about two hours outpatient. Doctor had called and said the levels were low. We need you to go in. So we went in. I'm sitting in the emergency room with my family member, and I'm thinking, as I sit there and watch the folks come in, you know, what we're here for is not really an emergency. And should I be sitting in this room with all the other folks that are coming in with their own situations? And it got me thinking, you know, okay, there's got to be a better way. Not everything's an emergency when you need to go to the hospital. The second issue I had was the procedure, give or take, it's about a 2-hour procedure. from the time we checked in to the emergency room and then the time we left, it was over 7 hours. So it got me thinking of a couple things, right? How can AI help the customer experience, right, in these type of situations? And then secondarily, I was also sitting there thinking, this is a business, right? There is a business here for, for them to continue to keep my family member there, even check them into the hospital, even have them stay for a couple of days. And do those lines get blurred sometimes between, doing the right thing for the patient and then trying to make profit margin? I'm sorry, there's a lot in there, but those were the things I was thinking about it as I had, 7 hours to think about it, to contemplate it. So it really got me thinking that there's a lot of things in play here, and how can we, one, make it better, and two, how can we justify the difference between a business and doing what's right for the patient, and both.
So it's a very, very loaded question, Bob. There are
Yep.
too many questions. It's too many questions. If I look at patient experience, is definitely one of the how to enhance the patient experience when you're waiting in the waiting room with other. I mean, I have had a family experience where somebody had to wait in the waiting room, and they were other COVID patients, and unfortunately, that person passed away because he contacted COVID in the waiting area when in the just initial stages of when this whole epidemic started, when we didn't know much about it, how it works. So that's one. And then procedures actually need 2 hours or max 2.5 hours, and then you actually spend 7 hours in the hospital. Is it really kind of, it's affecting both ways. It's not only affecting the patient experience, but it's also affecting the throughput of the hospital, because the hospital beds, doctors, they are being consumed while you are still there, and they are very, very expensive resources. So David, I would like you to kind of, because we actually at Insight, we have some kind of solutions we offered where patients, they don't have to, they're kind of the apps which tells them how to check in, where they are, how to navigate through the hospital system, so that the extra waiting time they spend in the A&E, that can be minimized. David, do you want to elaborate on that app? We did
Maybe you're on mute.
We did for Children's Hospital.
Yeah, sorry. So just taking a step back to kind of address the question globally. So the U.S. healthcare system is transitioning over a decade or so from what was called evidence-based care or episodic care, where you could go in as many times as you want, and they'll see you, and they'll give you the test, and they'll give you the medicine, and they'll gladly see you again next week, to value-based care, meaning that insurance companies and the government for Medicare and Medicaid patients are going to pay on outcomes and pay on prevention, right? So what are you doing to prevent a patient from having this reoccurrence, happen again? And obviously there are some medical conditions where that's just not possible. But for the most part, there are. So, and I think the decentralization of care in the United States is going to play a huge role in time saving. So not only we've seen an explosion of telehealth. So, I can get on a virtual discussion with a clinician and say, look, I've got a sinus infection again. I need amoxicillin, and it can be delivered to my house. I don't even have to leave, right? I can keep working or doing what I'm doing, and the prescription shows up within an hour and a half. That's where we're heading in terms of just qualitative interaction. And obviously we have apps that do surveys for daily living that help you understand what are your propensities for greater risk in terms of your health systems. We can match that kind of branch and skip logic, and that conversation that you could have with a virtual health assistant in the morning. How'd you sleep last night? What was your pain level? Are you nauseous? Are you more nauseous than you were yesterday? So those answers that you provide, and speaking again, now we're getting natural language processing. So we're picking up, you're creating a conversation rather than entering into a mobile UI and checking a box, or sliding your finger up and down in terms of, so you're getting a much greater picture of the patient's condition. We can even understand when patients are in pain from a cognitive services perspective. So a lot of good things are going to happen to decentralized care. So you see a huge increase in community care centers. You have health systems in your neighborhoods, but now you're seeing kind of satellite offices where they have kind of primary care, minute clinic, doc in the boxes, all that type of thing. They're going to continue to provide more and more services like infusion, for example. If you need a transfusion for something, or if you need something that is non-emergent, then they want to keep you out of that hospital because A, it's more dangerous from a health perspective and you're compromised, and B, to your point, it takes a hell of a lot longer. So I think we're going to continue to see more value-based care delivery in the country. That's what the insurance companies are going to reimburse on. We're going to have more connectivity to experiences that allow us to interact more freely. And then we're going to have more services available to us, like delivering medications, virtual consultations, and community-based care delivery that's right down the street. You don't need to, go up or down into a parking garage, 12 flights to be able to find a parking spot and then walk into this huge labyrinth to, get something done. You can pull in and have an appointment and just be seen and get in and get out. So that's where we're headed.
Good. Yeah, that's good news.
And the interesting kind of thing, the business, like in the hospitals, where we are in the business of providing care, but the hospitals, the traditional models being like they are reimbursed on the procedures they have provided. So it was more, the reimbursements was more volume based. And as David mentioned, it's moving from volume based to value based. And in the value based, you are responsible for the well-being, for taking care of the well-being of the certain population. And that just changes the whole dynamics between purely business, purely like a capitalist kind of a mindset, to actually more like the care we are providing. So we are really focused about the health outcomes of the population. Then that's where data and AI can really, help the hospitals in understanding their community better, in understanding the social determinant of health factors which affect the health of the communities, and be more proactive in managing the well-being of human populations.
Yep.
Wow, that's great. I had no idea on that value based. That's news to me. So thank you so much.
Sure. Let's hope it gets there.
So just
Yeah.
Yeah. Well, you got to start with a vision. So that's right. Really good. And just to sort of segue from, I think, a hospital centric conversation to just sort of a personal health conversation. I've just like today, just kind of doing a little bit of research before this, came across something that I hadn't read before, this notion of an internet of medical things, which, it makes a ton of sense. I imagine things like the Garmin device or things that are capturing my personal health, on a, as a device, and then mapping that data to, some form of algorithm to help me become a healthier person. I'm sure there's a huge story there. Anything that we think about when we get into that space?
Wearables, medical devices, like they are going to play a big role. And Internet of Medical Devices is all about, like, I'm sure, are you guys wearing your Apple Watches, Fitbits?
Yep.
So they are generating enormous. They're generating enormous amount of data continuously all the time, right? And those signals, right? That data, if it get integrated into our EHRs, that's kind of proactively warn you if something. There was recently a project by Omron, the blood pressure measuring company. They were like zero heart attack kind of. The project was zero heart attacks, and they had this watch which. They were quite advanced in their technology, which was not only measuring the heart rate and other things, but also the blood pressure continuously of the patient. So you can proactively, you can see the trends. You are 24/7 getting monitored. You can see the trends. You can see how your physiology is performing, and can have a proactive, measures to address those. If you get the warnings, your heart is kind of, the rate is not what it needs to be. So all those, and David, we have done some similar work in the chronic disease management, in the diabetes, and do you want to add on this?
Yeah,
but
sure.
Wearables are going to have a big role in future. In fact, one of the interesting things I wanted to say was Apple's CEO. Sorry, David, I just wanted to pass on to you, but then this thinking, he said, if you look back in the kind of after a decade, you look back, what was the Apple's major contribution to the mankind, and that would be in the healthcare, and that's kind of amazing. So definitely, he's talking about the wearables, the Apple devices, which can proactively kind of allow us to have those preventive measures.
Yep.
Sorry, David, I'll pass on to you now.
Yeah, sure. So obviously wearables, everyone has a supercomputer in their pocket, and it's connected to smart devices like a watch, other medical devices that you'd be wearing. You have diet, fitness, nutrition applications. We know how many steps you do. We're getting better at monitoring your CO2 and your O2 respiration. So there's a lot of benefit that's coming, and it's being miniaturized to the point where you can wear it, and it can provide a continuous or periodic assessment, and then be able to scattergram that and understand, what are the differences in you from morning to afternoon to evening, in terms of your breathing, your respiration, your heart rate, your blood pressure, all kinds of different things. So that's all going to be goodness, and it's only going to benefit you. I think the biggest offer, and then obviously we're bringing more intelligence to the edge in terms of just Internet of Things, right? We're bringing compute to those devices to be able to start making decisions. So we don't have to centralize all that information and then compute on it. We can compute on it at the edge and then basically send those kind of advanced messages into healthcare providers or to patients to say, look, we think that, you've got an AFib arrhythmia issue that's popping up that we're concerned about. We need you to go take your medication, call your doctor, that kind of thing. So in addition to that, you look at chronic disease. Chronic disease is becoming much more chronic than it ever was. There are children being born today with, there's gestational diabetes, there's juvenile diabetes, there's a global obesity problem, and obviously that leads to many early onset challenges. Certainly nutrition is a big part of that, but when 60% plus of any chronic disease is lifestyle modifiable and preventable, it's understanding what is your propensity for change. I know I need to stop drinking. I know I need to start working out, doc, but I'm just not doing it, right? So I continue to have hypertension and diabetes. So I think AI can help play a role as a health coach. And what is your propensity for change? From a lifestyle and behavior modification perspective, how can we gamify and make that personalized experience meaningful to you in ways that just aren't when you see the doctor twice a year or once a year and they say you really need to start doing this or that. Yeah, I know I need to lose 20 pounds. I'm going to start getting on it. I'm going to get back to the treadmill. Well, if you have something that is with you that's looking at your activity and things every day with your permission, then it can provide you more interesting information about your health improvement, your health risk and decline. So I think we can be more impactful in helping to educate patients and motivate patients and support patients, through social listening and social media, for your family members and so forth. So I think all of that plays an interesting role in the future because chronic disease is just such a pervasive issue globally, and that's a huge cost center.
Yeah. Awesome. I've exhausted my questions, Bob.
Yeah, well, I think we've come to the end, but that is fantastic. I love the idea about devices, right? Being able to prevent someone that's high risk for a heart attack, to know exactly what's going on before one starts, having better information on your wrist, right? I always wonder when I go in and do blood pressure at the doctor's office and it's good. I always wonder, well, how do you know it's good today but bad in 20 minutes when I go back to work, right? So, being able to get that information, I think is just great. So thank you both again. Really great information. You taught both of us a lot, and hopefully the audience got a lot out of it as well. So thank you for your time today. Very much appreciated, and want to wish everyone a happy holidays, and we will talk to you next year.
Looking forward to it. Happy holidays, everyone.
Thank you, and happy holidays, everyone.